One, it can also be used for respiratory tract infections. It can be used for urinary tract infections. It can also be used to treat gastrointestinal tract infections. It can also be used in treatment of some conditions such as meningitis and even sepsis. These are conditions in which you use aminoglycoside for. And let me now also tell you the side effects, many general side effects of these drugs. One, we have the kidney damage, will also lead to kidney damage. Remember, drugs are meant for therapeutic purpose, but whenever they are given in overdosage form or in appropriate manner, it could also it also produce an adverse effect. That is an unwanted effect of drug after the administration of drug. So you should put this in front of your mind that after administering this drug, it may produce effects like kidney damage, hearing loss, and even dizziness. Kidney damage in the sense that there are going to be conditions that are going to be related with kidney, meaning problems associated with kidney. These are the little problems that are going to arise before it even lead into or cause kidney damage entirely. Even the hearing loss too. Then after the aminoglycoside, we have the next one, which is the cephalosporins. Cephalosporins are also part of antibacterial drugs, which their mechanism of action, that is how they act on the bacterial cell. They act on the bacterial cell by inhibiting cell wall synthesis. Bacteria are made up of cell wall. The way our own human cell is made up of cell membrane, they are not cell membrane, but cell wall. This cell wall are of two types. We have the cell wall of bacteria that come in double bond, meaning they are double. There are some bacteria that come with single cell wall. There are some bacteria that the cell wall is thicker, while there are some bacteria that the cell wall is more lighter. So it depends. And that is why by the time you administer this drug, in some cases it doesn't work. You have to use another class of antibacterial before you're able to work, or probably you use you use two drugs in form of synergy to produce the effect of synergic effect. But in case of inhibiting cell wall synthesis, remember I told you in my last class that the bacterial cell wall is built up with a structure of glucose. It is a glucose that form block to build up the cell wall of bacteria. And these block these glucose are form block are coming together of proteins. There are thread-like of proteins that joins this block of glucose together. And that is how the wall or the cell wall of bacteria are being built. It's just like whenever you are aiming to build a house, you know you are going to bring blocks together. Then for that blocks to stay in position, you need to break cement that will hold it together. It's just the same as that of bacterial cell wall. The block of glucose come together, that have been attached together by the thread-like and structure of a protein that hold them together. So what happens is, if you administer drug like cephalosporin, they act directly on the cell wall of the bacteria, and what they do is to break down the chain of these proteins so that these proteins are not going to be able to hold down this glucose block together. And by the time they are able to break down the chain of this protein, it means the wall is going to collapse. And if the wall of the cell wall of the bacteria collapse, it will give room for even water and everything to penetrate into the cell of the bacteria. Most especially water. And by the time water penetrates into it, it can expand the cell of the bacteria, and at the end of the day, it will burst. And if it bursts, it means that that bacteria has been destroyed. And that is how this drug acts upon the cell of the bacteria by inhibiting the cell wall. Then example of this, some of these cephalosporins are ceftriaxone. Ceftriaxone, we know it's a common drug we administer. Then we have ceftriaxone, which is also very common. We also have cefalozolin. Cefalozolin is also common, but not in all institutions or health organizations you see it. It depends on the hierarchy or the class of the organization. Maybe probably in tertiary organizations where you manage intensive cases. Then we have cefalexin is also one. You can see out of these four we mentioned, ceftriaxone and ceftriaxone is the most commonest one we use day in and day out. compared to cefazolin and cefalexin, which is not too common like other two. So these are examples of cephalosporin. Then what are now the indications of cephalosporin? I've told you what indication is earlier, the reason why you are administering cephalosporins. And here it is often also used in management of cases like gonorrhea, pelvic inflammatory diseases, and sinusitis. They are also used in treatment of urinary tract infection. Also use it in treatment of conditions like cellulitis, and also they are also used in treatment of conditions like orchitis. That is purely the inflammation of the testes. Then general side effects of cephalosporins, we have nausea, vomiting, loss of appetite, abdominal pain, and diarrhea. These are the common side effects you see after you administer drugs of the drugs that belongs to class of cephalosporins. Let me repeat the side effects. We have the nausea, the vomiting, the loss of appetite, the abdominal pain, and also diarrhea. Now let's go to the next class, which is the penicillins. Penicillins are also one among the class of antibacterial drugs, which their mechanism of action is to inhibit cell wall synthesis, the same as that of cephalosporin we just mentioned now. Their mechanism of action is to inhibit cell wall synthesis, and I'm sure that I just earlier explained what the inhibition of cell wall synthesis is. So the penicillin has the same effect with that of cephalosporin. An example of penicillins, we have amoxicillin with clavulanic acid, we have ampicillin, we have oxacillin, we have penicillin V, and we have penicillin G. Now, what I want you to know under penicillin is whenever I look at it, it has the same mechanism of action with cephalosporin, right? But let me tell you the little bit differences in respect of mechanism of action. Whenever I look at it, maybe out of these examples of penicillin I listed now, such as penicillin V and penicillin G, they are basic penicillin that was early introduced just to act on the cell wall of the bacteria by either reducing the multiplication of microorganisms or even destroying the microorganism itself. But a time came when when microorganisms became resistant to this penicillin V and penicillin G. And since it became resistant to penicillin G and penicillin V, they have to introduce another form of penicillin called amoxicillin. And that is because of the bacteria became resistant to penicillin V and penicillin. That is why amoxicillin was later introduced. So any other class of penicillin. We are going to make a time to discuss the generations of penicillin on its own, because penicillin is made up of generation. So that's going to be a brief and special class for that, so that we won't mix things together. Then we have indications for penicillins, meaning what are the reasons why you give penicillin. Penicillin are common treatments for a variety of skin conditions. They are used in also treatment of middle ear infections, the kidney infections, and also the blood infection. What I mean by kidney infection, it could be either urinary tract infection, because whenever you say urinary tract infection, it has covered every infection that is related to kidney. So urinary tract infection, ear infection, and also blood infection, which could be other septicemia. So these are the basic indications for penicillins. That are the reasons why you are giving penicillins. Then we have side effects for this penicillin, general side effects. The general side effect for penicillins, we have the nausea, the abdominal discomfort, diarrhea, headache, yeast infection, and liver diseases. If one or you are able to administer penicillin to a client or a patient, these are the expected effects you are going to see. So it shouldn't be something that is new or going to be impromptu whenever you come across this effect, because they are usual side effects you see even after administering any drug that belongs to the class of penicillins. So I want you to get that. Then after penicillin, we have another class called the tetracyclines. Tetracyclines are also one among the class of antibacterial drugs, which their mechanism of action is to inhibit protein synthesis, the same as that of the first one we mentioned, which is the aminoglycosides. And I'm sure that earlier I've already explained how it inhibits protein synthesis, but specifically the 30 subunit. Remember, I told you we have two subunits of protein. We have the 30 subunit and we have the 50 subunits. So this one acts precisely on the 30 subunits to inhibit the synthesis of protein. Synthesis means activation. Bacteria are also made up of DNA protein, but these proteins are not always active in their body. They need an external substance to activate it. So what this drug does is to go and prevent the activation of that protein. And if that protein is not being activated, there's no way the bacteria is going to act upon your body. It will render the bacteria useless in your body. And that is why this protein must be activated. And the work of this drug is to stop the activation of that protein. So the general indication, okay, examples of tetracycline, we have doxycycline, we have tetracycline itself, we have minocyclines, and we have sericyclines. These are examples of tetracyclines: doxycycline, tetracycline itself, minocycline, and sericycline. These are examples of tetracycline. Then the general indications for tetracycline, that is the reason why you are administering tetracycline to a patient. One of the reasons is where you administer tetracycline just to treat like common chest infections. There are infections that are related to chest or thoracic cavity. You use tetracycline to manage these infections. We have also urinary tract infection. There are also drugs that in which they are used in management of urinary tract infection. We also have pelvic inflammatory diseases. You can use any of this group of tetracycline to manage PID. That is what they are trying to tell you here. We also have dermatitis. You also use it to you administer it in management or treatment of skin infections. That is, dermatitis means inflammation of the skin. So we also use it in management of other skin infections such as acne. The acne, you use it in management of acne. Acne is a what's it called, skin infections. So they are now telling you that majorly these drugs are effective when it comes to management of skin infection. You can see they are not antifungals, but they are antibacterial, and still yet they are used and very effective in management of skin infections. But we all know that skin infections are majorly used in management of they are managed by using fungal drugs or antifungal drugs. So, but you can see antibacterial now can also be used in managing skin infection. The general side effect for this drug, we have abdominal discomfort. You can see majority of these antibacterial drugs, majorly abdominal discomfort happens to be some of their side effects. So we should take note of that, so that a situation where after administering drug for a patient, then at the end of the day, you now come, patient will be complaining, I'm having abdominal discomfort. So it shouldn't be something new to you. It should be a kind of something that is not going to be impromptu, something that you are aware of that is going to happen. It's just like whenever I want to administer ceftriaxone, you know, one of the common side effect is nausea and vomiting. So if you are seeing most of these adverse effects, you should have put it in front of your mind that yes, this is something you expect. And if you don't see it, fine. Then after abdominal discomfort, we have nausea and vomiting as one of the side effects of this drug. We have diarrhea as one of the side effects of this drug. And we have decreased appetite. Decreased appetite, not loss of appetite. There's a difference between loss of appetite and decreased appetite. One can lose appetite and wouldn't have preference for any food. But whenever you're having decreased appetite, not that you cannot eat food, you'll be eating food, but the amount in which you are going to be taking that food will be so limited. And that is what it refers to, decreased appetite. So these are some of the side effects of tetracyclines, general side effects. Then I want you to take note of this general indication and general side effects we are mentioning, because I will give you an assignment to pick the most commonest drug of each of these classes to go and develop it on your own. That which has to do with, I will give you guidelines on how to develop them, so that's going to serve an assignment to you. Then let's go to the next one. The next one is quinolones, either quinolones or fluoroquinolones. They are also one of the drugs among the antibacterial drugs, which their effects or mechanism of action is to inhibit DNA replication. Now, this is another different mechanism of action compared to the ones we've been mentioning. Whenever I look at it, the ones we'll be mentioning is either we mention to inhibit protein synthesis or to inhibit cell wall synthesis. But this one is quite different. Whenever I look at this one, the mechanism of action is to inhibit DNA replication. What do we mean by DNA replication? We, all living things, not human, not animal alone, even plants. Plants have cells and they also have their DNA. So this DNA is just like the life wire of a living thing. Meaning without DNA, there is no way a living thing can reproduce. It's because of this DNA that is why an individual or human being can reproduce. Even microorganisms, since they are living things. Now, what happens in DNA replication? In the bacteria cell, the DNA tends to copy or produce different copies and numerous copies. And if DNA is being photocopied, it means that there's going to be more bacteria. The more the replication of the DNA, the more the bacteria. And that is why you can see the replication of DNA always come rapidly, and that is why in just 1 minute, bacteria or microorganisms can give birth to themselves like 3 million in just 1 minute. And you human being, how many days do you give birth? It takes you very longer time for you to be able to reproduce. But then in just 1 minute, they can reproduce more than 3 million. You can see how rapid they grow. So in this aspect, if you administer this drug, either quinolones or you call them fluoroquinolones, this drug acts on the bacteria DNA to stop the photocopying, to stop the replication. Replication means just to copy the DNA. So if the replication is being stopped, it means that there's not going to be multiplication of these microorganisms. Like you've reduced the amount of this microorganism in the body because they won't continue to give birth again. So that is the mechanism of action for quinolones or fluoroquinolones. Then let's look at the indications. Why do you give quinolones or fluoroquinolones? That is, if you give it in case of conditions like urinary tract infection, you give it for conditions like skin infections, bone infections, and infections of the joints. I want you to understand that there is a difference between bone infection and joint infections. There are infections that specifically affect the joint, such as osteoarthritis, rheumatoid arthritis, and any other form of arthritis, bursitis. There are inflammations of any structure that is around the joint. It can be the elbow joint, it can be the knee joint, it can be whatever joint it is, the hip joint. So there are infections that affect this joint because whenever I look at it, these joints, inside them, they are made up of fluid. And this fluid, they are placed for bacteria to settle if bacteria or microorganisms have access to it. So you can use this drug to treat these infections, the bone infection, the skin infection, urinary tract infection, and even joint infection. So now let's look at the side effect of this drug, general side effect. After giving this drug, what do you think could be results after giving this drug? One, we have gastrointestinal reactions like nausea and vomiting, which is very common in other drugs too. We have dyspepsia. Dyspepsia means indigestion, a situation where you eat food and the food could not digest. That is what is called dyspepsia. So it is very common sign of a side effect for quinolones. You can administer ciprofloxacin and the person will have dyspepsia, meaning the person might later want to take food, but the food will not be digesting adequately. So if you see this side effect, shouldn't be something new to you. And after dyspepsia, we have dizziness. It's also one of the side effects. Then we have insomnia. Insomnia just is a typical, we all know what insomnia means, inability of one to have adequate rest, maybe sleep, or find it difficult to sleep at night specifically. Not only at night, we can have insomnia even in daytime, but specifically at night. So if you are finding, you can give ciprofloxacin or fluoxacin or levofloxacin. These are examples of quinolones. You can give any of these quinolones to a patient, and patient will be coming up with these complaints. So you should know that these are the side effects. And also lastly, we have headache. Headache is also one of the common side effects for what's it called, the quinolones. Either ciprofloxacin or fluoxacin or levofloxacin. These are examples of the quinolones. Then let's go to the next one, which is the macrolides. Macrolides are also one among the class of antibacterial drugs, which their mechanism of action is to inhibit protein synthesis. But this time is not 30 subunits, it is 50 subunits. This time is not 30 subunits, it is 50 subunits. Remember I told you, I say in the cell of the bacteria, we have DNA, and the DNA is made up of protein, and the protein is divided into two. We have the 30 subunit, we have the 50 subunit. Remember, other drugs will be mentioning, other classes will be mentioning that their mechanism of action is to inhibit protein synthesis. They only affect the 30 subunit, not 50. But in case of macrolide now, they affect the 50 subunit. The 50 subunit is the most largest subunit of the DNA. the part of the protein is the most largest part. And that is why in macrolides, they are majorly, the mode of their action is a form of broad spectrum antibiotics. It's killed a wide range of microorganisms. It's not being specific. Whenever you administer to a patient, it can kill a wide range of microorganisms, and that's why it's used in management of multiple diseases. Then, example of macrolides, we have erythromycin, which is very common. We have clarithromycin, we have azithromycin, and we have fidaxomicin. We have erythromycin, clarithromycin, azithromycin, and fidaxomicin. These are examples of macrolides, and they are broad spectrum antibiotics, meaning the antibiotics are whenever you administer them, it can kill a wide range of microorganisms. Then let's look at the general indications. Why do we give any of these macrolides? Macrolides are basically effective in treatment of respiratory tract infection. That is why even you as you a caregiver, sometimes patients will come to you, I'm having sore throat. If a patient will come to you, I'm having sore throat, what do you think of? You always think of maybe there is urinary tract infection. So what you think of, one of the drugs you always think of is erythromycin. It's very, very effective in management of respiratory tract infection. That is why by the time patient is there, I'm having sore throat, you also okay, go and take erythromycin, because it's very effective in management of respiratory tract infection. It's also used in treatment of urinary tract infection too, not only respiratory tract infection. Then it's also used in treatment of sexual transmitted infections. Sexual transmitted infection is also used, it's very effective in managing it, such as the gonorrhea. Gonorrhea is one of the sexual transmitted infections. Syphilis, they are all what we call sexual transmitted infection. So you can administer it in case of STIs. Then we have skin infections too. It's also, we are meant to understand that it's also very effective in management of skin infection. You can use it to manage skin infection too. You can see how great antibacterials are. It means that it's not only antifungals we use in management of skin infection. You can also use some of these antibacterials. So I want you to take note. Then the side effects now, the general side effect of macrolides. One, we have gastrointestinal issues. What do you mean by gastrointestinal issues? It could be either nausea, vomiting, diarrhea, constipation even. They are all gastrointestinal issues. These are the issues related to your GIT, which could bring either indigestion, could bring out malabsorption, or could bring about lack of one or food not moving freely within your digestive tract. So we have hearing loss is also one of the side effects. You can see most of these antibacterials, hearing loss happens to be most of their side effects. So, and that is why we need to be careful when administering these drugs. Then we have cardiac arrhythmias. Cardiac arrhythmias is otherwise known as heart attack, where you have bradycardia, you have tachycardia. It could be irregular heartbeat. It can be a situation where heart will increase in beating, and also a time will come it will decrease on its own. There's going to be always irregularity, and that is arrhythmia. So if you are after giving macrolides, any of these, either erythromycin, clarithromycin, or azithromycin, you can give it, and a later patient will tell you, my chest they overbeat, I don't know what thing they happen. So they are all part of the side effect. You should have taken note of that. Then after that, we have abdominal pain, yes, which is very common, and also taste disturbance. Whenever I say taste, to taste something, meaning you will not be, you use tongue to taste something. Either you want to taste if it is sugary, if it is salty, whatever it is. So in this aspect, if you take any of these macrolides, you may be having problem with your taste. Maybe you will be asked to taste sugar, you will not feel the taste, or salt, you will not feel the taste of a salt. So this is going to be exactly what is going to happen after you administer any of these macrolides. So this is just that about macrolide. Let's go to the next one. The next one is sulfonamide. Sulfonamide is also one among the class of antibacterial drugs, and which their mechanism of action is to inhibit folate synthesis. You can see this sulfonamide is very special. It's having its own mechanism of action, which is different from any other one. Then let me now tell you how it inhibits folate synthesis. In our body, we all, if it is human being, we the living human beings, the source of our folate is from the food we eat. Our folate is something, a structure or substance that is very, very important for our body to maintain our body integrity. But where do we get this folate now? We the humans, we get this folate from the food we eat. It could be either the fruits, the banana, the vegetable, and other food we eat. We get folate from different types of food we eat. That is the source of our folate. After we take it into our body, these folate are the one that maintain the integrity of our cells. And remember, cell is the structural and functional unit of life. Without cell, there will not be life. So for cell to be maintained, it needs this folate in your body. Now, that is for human being. Then for bacteria now, because that is our area of concern. For the bacteria now, then they don't have anything they eat, because what bacteria feed on is human being. They don't feed on anything rather than human being. So since you are the only their source of nutritional pattern, what they do is they have natural folate in their cell. The bacteria or microorganisms have natural folate in their cell. Then this folate is being produced by a specific enzyme. There is an enzyme in the bacteria cell that produces this folate. So instead of we human being getting it from another source, them bacteria naturally they have it. God has just blessed them with it. So whenever I look at it, this folate, for the cell of that bacteria to the integrity of it to be maintained, it needs the presence of this folate. Then if you administer any of these drugs called sulfonamide, they will go directly to the enzymes that produce that folate to tell the enzymes to stop producing that folate. And if the enzymes stop producing that folate, it means the bacterial cell will be rendered useless. Because remember, I told you, it is the presence of this folate that maintains the integrity and the function of the cell. So if these folate are not being produced, will the integrity of the bacterial cell be maintained again? It won't. And it will render the bacteria to be useless in the body without performing its normal action on your body again. So it means that at the end of the day, without that folate, that bacteria will die off. And that is how this sulfonamide acts by killing the bacteria. Now, what example of sulfonamide we have? We have sulfadimidine. Sulfadimidine is an example of sulfonamide. Then we also have sulfametazole. We have sulfametazole is an example of sulfonamide. Then we have sulfasalazine. Sulfasalazine is an example of sulfonamide too. Then we have sulfacetamide is an example of sulfonamide. So these are examples of sulfonamide. Let me mention them again. We have sulfacetamide, we have sulfadimidine, we have sulfasalazine, we have sulfametazole with trimethoprim. These are a combination of drugs that form sulfonamides. Then, what are the general indications for sulfonamides? Meaning the reasons why you give or administer sulfonamides. One, we have urinary tract infection. We have you administer sulfonamide, for example, if a patient is resistant to chloroquine in management of malaria when it comes to Plasmodium falciparum. You know, basically, out of the plasmodiums that causes malaria, is the parasite is majorly is Plasmodium falciparum. Is the one that is very common in sub-Saharan Africa. But a situation you come where you know chloroquine is very effective in management of malaria related to Plasmodium falciparum. So if a situation happens this way, you can give any of this sulfonamide to augment or to support the effect of this chloroquine. That is another way in which, or the reason why you give sulfonamide. It also can be used in management of urinary tract infection too. It has been mentioned. Also, sexual transmitted infection, it also can be also used in management of it. Then sulfonamide are also mostly common use with other antibiotics, meaning they are supportive drugs too. Maybe a situation where you want to
No sound, sir.
Which Englishman was killed?
No sound, sir.
Hello, class. Can you hear me? Hello.
Yes, can hear now.
We can hear you.
So we have condition like Steven Johnson syndrome. That is not what we are to discuss. If not, I could have further explained what Steven Johnson syndrome is. We have vasculitis. It's also another side effect. Whenever you give sulfonamide that it produces, we have serum sickness too. We have fever. We have anaphylaxis too. There are other many more, nausea and vomiting, which is national anthem, very common. That if you lack idea about side effect, you will mention nausea and vomiting. Maybe we will even advise so that nausea and vomiting will be removed from the side effects since it has turned to national anthem. So these are major side effects for sulfonamide. So I think we are going to stop at this junction. Whenever we meet next time, we are going into another class of drug, probably antihypertensive drugs. I want us to go and read on antihypertensive drugs so that we're going to the next class is going to be an interactive session, probably after my class. But like I said, if you look at examples of these drugs, starting from the first one we mentioned, which is aminoglycoside, under the class of aminoglycoside, we have examples such as streptomycin, gentamicin, amikacin, neomycin. Please, one thing I want to advise you of, if you want to be more familiar with this drug, make sure you look at, and if you obtain a drug, maybe from the pharmacy or elsewhere, there is always a pharmacopoeia of that drug inside. What I mean by pharmacopoeia, there's always a small book inside that drug. Please always take your time to go through that book. Every information about the what's it called drugs is written on that book, including the dosage of this drug. Because dosage is very, very important. But as you can see, here we just mentioned some important aspect of it, left out with dosage. Reason I have not to talk about dosage here is because I'm talking about a particular class generally. So it's not an assignment for you to go and look for the dosage and other information about this drug. Then after aminoglycoside, we have examples of cephalosporin, such as cefprozin and ceftriaxone is the common cephalosporin we use. So I want you to go and look for the information about cefprozin and ceftriaxone because they are very common. Then we have examples of penicillin too, amoxicillin with clavulanic acid, that is otherwise known as augmentin. Then we have ampicillin, we have oxacillin, we have penicillin V, penicillin G. Forget about the penicillin G and V. Look at the amoxicillin with clavulanic acid, ampicillin, and oxacillin. They are, and the clozacillin too. They are example. They are just common penicillins, the drugs that belongs to penicillins that we have. Please go and look for information about them, especially the dosage, how they are administered, and the form in which they come, because there are some that come in IV, some that come oral and parenteral, some even come rectally. Then we have tetracycline. Example, doxycycline, tetracycline itself, minocycline, and sericycline. But specifically, I want you to work on doxycycline and tetracycline because that's the commonest one among the class of tetracycline. Then we have the class of quinolones are fluoroquinolones. Example, we have ciprofloxacin, ofloxacin, and levofloxacin. All of them are very common. So I want you to go and look for information about them. You can see here, some of the information I want, like mechanism of action is general. I've already written it here. Indications, I've already written the indications. Side effect, I've already written it. Then what you need to add up to this information now is the dosage and the route of administration. If it is given IV, if it is given IM, if it is given oral. That is another information I want you to go and look for. And also, I want you to go and look for nurse's responsibility. What do you think are your responsibilities as a nurse whenever you want to administer these drugs? Are we together? Then we have macrolides. Example of macrolide, we have erythromycin, clarithromycin, azithromycin, and fidaxomicin. This example of macrolide, I want you to go and look for erythromycin, clarithromycin, and azithromycin. They are the commonest macrolide you see. Please go and look for their information. Then we have sulfonamides. We have sulfamethoxazole and with trimethoprim and sulfasalazine, sulfacetamide. But the most commonest one among is sulfadimidine is very common too. Sulfasalazine is also very common. And also sulfamethoxazole is also very common. So you want to look for other information about it. Like I said, the information you are going to add to these ones now is the dosage of each of these. And after the dosage, you also look at the nurse's responsibility and route of administration. Is it giving IV, IM, or whatever route it is giving? So that is, I think this will mark the end of today's class. Like I've said, whenever we meet in our next class, we are going to go into, because of time, we'll go into another class, which is antihypertensive drug, which I'm sure if we are to follow it this way, we are going to be getting it gradually, and the class will be getting more interesting as we proceed. Thank you very much. I will give forum for also question. If there's any other question, please, you can ask before we close for today. Is there any question? Unmute your mic so that you can ask question, please.
Hello, good evening, sir.
Question. Hello. Do we all understand?
Hello, good evening, sir.
Evening, how are you?
I'm fine, sir.
Yes.
Mine is not question because
Okay.
yeah, it was very clear. I'm talking about the assignment. Maybe the assignment
Okay.
should be seen in the main group so that we'll get it there
It
very
should
well.
be in what?
In the main group, the assignment should be
Okay,
written
in main group, right?
Yes, sir, so that we'll have the questions there, sir.
No problem.
Thank you, sir.
Yes. Any other person?
Hello, sir.
Hello, how are you?
I'm fine, sir. Thank you for the wonderful lecture. Please, I want to ask, how can we get the
Welcome.
material? How can you get the material?
I'm still working on it. By God's grace, all materials you are going to get it.
Okay, sir. Okay, sir. Thank
Yes,
you, sir.
welcome. Welcome. Yes, any other person? Unmute your mic so that if there is question you ask before we disseminate. It shows that we understand today's class, right?
Yes, sir. It was well understood.
So until we meet in our next class, like I've said earlier, we are going into another class of antihypertensive or group of antihypertensive drugs. We know is an area that we need to pay more attention and we need to participate, because hypertension is a very common case, and I'm sure that in our next class you are going to enjoy it very well, because I'm going to take my time to break down antihypertensive drug to your best of understanding. So, of no question, then probably we'll call it a.
Thank you, sir.
Thank you, sir.
To stay
Thank you,
tuned for
sir.
the next class,
Okay, sir.
as the next lecturer is coming.
Thank you, sir.
Thank you. Welcome. Thank you very much.
Thank you, sir.